Hello and welcome to Filibusters in Fine Print, where AMGA's public policy team gives you the insider view on healthcare regulations and legislation. Thanks so much for joining us for the latest from Washington, D.C.
Good morning and welcome to AMGA's Filibuster in Fine Print, our public policy podcast. Today we have a few of our policy experts. We're going to talk about regulatory and CMS affairs. Today we have
Alicia Sawyer, Government Relations Assistant for AMGA.
fantastic.
Hi, I'm Daryl Drevna, the Senior Director of Regulatory Affairs for AMGA.
All right. And are we letting the lobbyists talk or no?
Yeah, well, one of them.
Knock.
One is.
It's me.
Just you.
Because I'm obsessed with Dr. Oz.
It's me. So we're talking about Dr. Oz today because the secret is out, but
Yeah, I'm Lauren, Director of Government Relations at AMGA.
fantastic. And Jamie on the sidelines, but why don't you say hello?
Jamie Miller, Senior Director of Government Relations at AMGA.
Fantastic. And our producer is my guy. Does a great job. For the most part.
Yay, my God.
For the most part.
And Sharon is in the back. Doing
Shout
good.
out.
Yeah, it's
Special
fantastic.
guest audience.
Well, let's see. Because this is a sort of a regulatory focused podcast, Daryl gave me 6 points that we have to make. So let's go at it in order. First off, Lauren already talked about it. We're going to talk about Dr. Oz today and his pending confirmation in front of the Senate for Administrator of CMS. Couple questions. Why does this matter for Medicare, CMS, and health policy? And why don't we start with that? And then I think Elisa's going to talk about who he is first.
Yeah, Lisa, you want to tell us a little bit about who Dr. Oz is and how we got to this point?
Yeah, so Dr. Oz is America's doctor. He got his start on the Oprah Winfrey Show with his own little segment there. That led him to his own radio show, his own TV show, the Dr. Oz Show. But before that, he was a cardiothoracic surgeon. He got a degree at Harvard, and then he got his MD at UPenn, and then he was practicing at Columbia Presbyterian in New York, where he actually pioneered a lot of different cardiothoracic methods for surgery and did a lot of great work there. But that's also where he started moving into some other alternative forms of medicine, like hypnosis and things of that nature. And so Dr. Oz is a big Medicare Advantage advocate. He previously expressed his desire for MA for all. And in 2021, he ran for a Senate seat, which he ultimately lost. And during his race, he was critical of the government's handling of the COVID-19 pandemic, as well as some other issues. And around Dr. Oz in 2014, and he appeared in front of a Senate panel where he was criticized for his promotion of weight loss products. And also in 2014, the British Medical Journal found that 54% of his recommendations contradicted or lacked scientific evidence. So he's kind of got a lot going on here, so what he could mean is a little uncertain right now.
Okay, so he's a brilliant surgeon, and he also has some alternative ideas, which don't always comport with what his medical colleagues would agree to.
Yeah, one time he did surgery with Reiki. So he brought in a Reiki healer and performed surgery on a patient.
Did that work?
I don't know, but his other doctors did not like that at all. Because there's not a lot of proven medical evidence around Reiki, but he and his wife are all big alternative healing people, and always have been.
Yeah, that comes up. He started digging into his history, the folks at Columbia. He's got a base of support for the work he does as a surgeon, but he's always had this alternative, homeopathic, promoting lifestyle changes. That's always been part of his thing, and it really blew up for him when he got on the Oprah show, like Alicia said.
All right, well, I guess you could say he's well-rounded.
Yeah.
And there we go. And I believe the first physician to lead CMS, is that right? I think that's right.
I would have to go back. When I was there, it was Dr. Mark McClellan. I don't think he's.
Oh, you are right.
Yeah.
I am wrong. Excuse me.
Yeah.
But I like the subtle brag when you talked about when you were at CMS.
I was there. Yeah,
that was good. Yeah, I like that. Well done.
A little bit of,
Mm-hmm.
to work with the administrator now and then.
You did, which is why we hired you.
And
your
my,
great
wits,
personality. So, tell me, I guess we'll start with Daryl. What potential impacts will Dr. Oz potentially have on Medicare policy?
Sure, I think you're already seeing some changes at CMS based on, we have a secretary, RFK Jr., and just yesterday, the Center for Medicare and Medicaid Innovation canceled or is going to phase out a few models. So you're already seeing this effect of presumably Dr. Oz is going to pick up that mantle from RFK and continue to implement those changes. So I expect to see an emphasis, like Alicia alluded to, on Medicare Advantage. He definitely sees that as a way to expand coverage. And also that emphasis on prevention. He was on a podcast a couple of years ago talking about how fractured the healthcare system is and how it doesn't make financial sense for providers to focus on prevention under the current structure. So he's really big on trying to address chronic disease through prevention. Now, that makes a whole lot of sense, but when you start looking into it, what he means by prevention, I think Lauren was talking about this. What exactly does that mean? Exercise, better diet, healthy lifestyle changes. These are all things that are non-controversial, but then there's some of these other things that he's talked about where it's not really lined up with, traditional or accepted medical science.
Okay, because certainly our members are into wellness and prevention, and
Yeah.
Dr. Oz talked about a fractured healthcare system, but not to brag, or subtle brag, but our members actually do that better than anybody. I mean, it's fully integrated from primary to specialty to hospital. So it's
exactly right. I
we
think
do it.
a lot of what he says, like, well, this just could have been written by an AMGA member, or this could have been endorsed by an AMGA member.
I think it goes back to the America's Doctor that he actually copyrighted. So it's his.
So we can't.
Yeah, I mean, like, he's a media personality, and that's one of the reasons why he was hired. Here's someone who can go on camera. This is how he got into the attention of President Trump. He would go on Fox News during COVID and make these sort of medical assertions about COVID, and so President Trump loves a media personality. He loves someone that's going to be out there. And he does do a really good job of explaining things. They might not be exactly, especially in the alternative, like healthcare space, things that people wanted to want to tout because there's not a lot of science behind it. But this man has been practicing since Oprah. He was also on a reality show that I loved called New York Med, where you basically, it was a reality show set at Columbia Presbyterian,
Really?
one of our members.
No kidding.
And I watched it every summer. I thought it was
Did
so
you?
great because he was sort of the lead into what it looked like to be in an ER. So he knows how to work his angles. He knows how to bring this down so that regular Americans can understand it. And that could be great, and also could be really dangerous.
Yeah, it's like, why is he qualified for this post? Well, 9 daytime Emmys and 4 million daily viewers can't be wrong, right?
That's pretty good.
Yeah.
That's about our podcast
I think
consumer
so.
uptake, I think, isn't it? Or
Or
close.
if the trends continue,
Yeah.
I'm thinking one of us is going to be the next TMS administrator.
That would be, that'd be great.
Yeah.
We'd have it in.
We have it in.
So Administrator Sawyer, I'm looking forward to that.
I'm working my way up there.
Yeah, good. Someone needs to. All right, so what so far is reaction from provider groups around Dr. Oz's confirmation? What do insurance think? Advocacy organizations, what, where are they on this confirmation, not confirmation, this nomination, excuse me?
I think people are holding their tongues
Mhm.
because at the end of the day, he is a doctor. But I think there was so much energy on RK Jr. as HHS secretary that it seems like Dr. Oz is getting a little less smoke, but I don't know. Something happened today that was really interesting. You have Dave Weldon, who was originally the nomination for the head of CDC. His nomination was pulled today by the White House. Apparently, it was also under the guidance of RK Jr. And so I think RK Jr. is also starting to flex his power as secretary. Dr. Oz would work under him. And so I think there's a little bit of caution now when it comes to these outside groups because, a lot of fear, and we're seeing it at CMMI, we're seeing it at CMS, there's going to be reductions in forces. There's going to be changes in the models. And so certainly because our members participate in these models, the question is, like, are they going to be able to continue, or do they want to stay on?
Yeah, no, even like so yesterday they announced they're going to cancel. They being CMS.
Thank you.
It's going to cancel. Let me check my notes real quick. Make sure the making care primary model, right?
Mhm.
And I got a text from a member. It's like, "Welp, they had put in a lot of time and energy into thinking this was going to be a long-term model, a sustainable model, and now it's going to be phased out very quickly." So that just causes a whole lot of uncertainty. And in that uncertainty, to build on Lauren's point, I think the groups have been, or those organizations have been fairly muted. They're just sort of like that, where everyone's in this wait and see or holding pattern to see what exactly comes out of HHS and then ultimately CMS.
Interesting. One of our broader points around our regulatory agenda is advocating to CMS that stopping programs midstream is just a disincentive to move to value or to move to anything that the model is trying to accomplish. So we'll have to pick up that mantle again. I think we're going to.
Yeah. It makes it's interesting because here you have Dr. Oz. He's been very vocal in his support for value-based care. Now, what that looks like is sort of confused, but he's definitely talked about like there is a lot of administrative burden in the healthcare system. We've got too many folks, focused. Our healthcare dollars are going into the wrong things on like regulatory compliance, administrative burden, and not into wellness and all that. But then at the same time, you've got the HHS or CMS is yanking some of the models that are really focused on making care primary care first. These were designed about getting folks into their primary care doctor, using advanced practice nurses to focus on prevention, get patients in so we can prevent heart disease, so we can prevent complications from chronic disease and that sort of thing. So how he gets in and, is it just going to be this push to get everybody enrolled into Medicare Advantage in some way, shape, or form, use that as the vehicle, and that causes all sorts of things because, not everyone's a fan of Medicare Advantage right now.
Yeah, I guess some of the beneficiaries don't like Medicare Advantage. I know our members do because it's a stable financial platform.
Yeah.
For the most part, it does add benefits, but sure, you need both. Both traditional Medicare, which won't go away, and Medicare Advantage, which offers some benefits to some.
Yeah, I also think a lot about CMMI and what the future is. This is something that's been coming up in Congress, especially last year, where, there are Republican members who have been really concerned about the models, whether they work or not, whether it's actually saving money overall for healthcare. And so you've seen like a couple of hearings in both Ways and Means and in Energy and Commerce last year that looked at these issues. And so now you have someone in that is your guy. And so the opportunity to change CMMI even more is probably going to happen, which will be interesting because there's not a lot of time and there's not going to be a lot of people to implement these changes. So I wonder what's going to happen.
Yeah, the staffing over at CMMI it's frankly concerning because if we're as AMGA members, want these models to succeed or trying to find a foothold in value, and this is the organization or that division within CMS that is tasked with overseeing and helping stand these models up. And the folks who are working there have a lot of them have just been shown the door. Like if you look at my LinkedIn feeds, it's hey, I'm open for work. I was working on the model over at CMS that was supposed to improve care for dementia, or I was working on the model that was supposed to improve care for dialysis, and they're no longer with the agency. So.
Yeah, there's a lot of federal employees that are looking for jobs right now.
Yeah.
So that is a big DC level issue of concern. So I guess there's some opportunities for us to talk about chronic disease, prevention, wellness, and value with Dr. Oz, which is helpful, and with Secretary Kennedy as well, I think. We always find issues of commonality when we talk to whomever is in charge in DC. So speaking of that, not speaking of that, another question. The confirmation process, will he be confirmed?
Yes, I believe so.
Okay.
He is, well, it also depends on how much he's divested. Has he completely divested from the millions upon millions of dollars that he has all across the healthcare system. You know, here's someone who has 14 patents of his own that he's created. I mean, he was implemental in doing the LVAD, which I learned from Grey's Anatomy. Which,
Forget college.
forget
just
college,
watch TV.
Grey's Anatomy and reality medical shows are,
That's great.
are
The
how
pit,
I've gotten
you
here,
like the pit?
honestly. Yes, the pit, all of it.
Halfway to an MD.
Halfway to an MD.
How about Scrubs?
Oh my God, the best.
That was
The absolute
my
best.
favorite.
My intro into medicine, period.
Mm-hmm.
But he is also vetted, right? Like he ran for Senate in Pennsylvania. He lost. Here was an election that he almost won, honestly.
Mm-hmm.
You know, he was really going after Fetterman. Fetterman had this sort of late surge that got him the win. But here's someone who also testified as Elysian Pension at Congress. He is very comfortable now with these members, and you know he was recruited to run in Pennsylvania by Republican members, so they want to see their guy have some sort of crossover to the finish line. And so, you know, I think a lot of the questions will be pointed. I think about Senator Whitehouse, who does a lot of work in promoting value-based care and these models, and I feel like a lot of his questions will be tailored toward that. So that'll be fun to listen to see what his responses are and see what the follow-up questions will be. But I can't see it being a situation like it was with Secretary Kennedy, which was a lot more controversial, a lot more heated.
And indeed, okay. Do you think he gets any Democratic votes at the for nomination?
I think no. Well, I mean, you know, Fetterman might do it because I don't know. We'll see.
He's taking that independent.
He's taking that independent course, but you're now seeing more Democrats not crossing over to vote for these confirmations because they realize A, some of their constituents don't love it, and B, like I feel like they finally have a messaging point of saying like we don't want to support these confirmations because we know these views might implement things that we don't like.
Okay.
So I if they're going to say no to say no to passing a CR, I can see them saying no for doing a confirmation.
All right. Very good. Let's see. How about a lightning round? We have never done
this.
So we're talking regulations. Let's talk lightning round.
Oh.
I mean,
Oh my
we
gosh!
do not
Listen
do that.
to Daryl right here. My God.
That's so good.
Daryl is very, very
Yeah.
excited. He put this in the outline,
Oh,
so that's why we're doing
he's
it.
prepared. We are not.
Well, Daryl sort of produces this whole thing. So, all right, Daryl,
All right, here we go.
I will read this. First major policy move, if confirmed. Lightning round.
Oh, geez. All right, it's got to be Medicare Advantage. There's a rule that's pending at CMS right now. It's over OMB. I see them putting a hold on that a little bit, so he can come in and really push more on the supplemental benefits, and it making it easier for plans to market and enroll folks into Medicare Advantage. See that, like, trying to boost those enrollment numbers in Medicare Advantage, I think is his first play.
Okay, maybe he'll talk to Joe Namath. Okay, how about a wild card headline in the first 6 months?
Americans required to take green coffee extract for weight loss and perhaps an omega-3.
That's a headline.
Something about CMOS.
Yes, CMOS.
Is that good too?
Yeah.
What is yeah.
That's a thing.
Yeah.
CMOS
It's
is a thing?
disgusting.
Yeah.
From Dr. Oz, or this is in general?
This is
Just in general, it's a holistic health trend.
Is this a Z thing?
Yeah,
Is
I would.
I feel like it's a millennial thing. I
It's
feel like
a
it's very
little
Gwyneth
bit-
Yeah,
Paltrow.
white guys say millennial.
Yeah.
I'm sorry. I'm an Xer, so excuse me.
Smoke and drink.
We don't smoke, but we double up another.
Yeah.
Okay, well, great.
Yeah.
All right.
I think the other thing that he is really going to try to do, and he's talked about this a lot, is how does the agency incorporate AI into clinical decision making, and how do we use that at a person level, at a patient level? He's really into bottom up type things, like here's the folks on the ground, patients, families, moms, dads, you know your children more than anybody else. So how can we use these tools that are being developed, AI tools, to help you live your best life? So that I think that's going to be something that he's going to focus on as well. And how that lands or what that looks like, I think is still unknown.
That is interesting. I know our members looking at AI,
Yeah.
and I believe we're going to talk about that at the annual conference.
We are.
Plug the annual conference, come to the annual conference, Dallas Fort Worth. You can hear the team at the public policy panel as well.
And we're going to do a podcast recording.
We already, yeah. We wanted to be live, but my guy said no.
Yeah, we don't have enough CC license because there is no more F-16.
Right. Well, who needs the feds?
Yeah.
Any final thoughts from our esteemed panelists?
We look forward to seeing you at annual conference.
Okay.
We'll be around.
Good.
So come talk to us. Please don't ask us hard questions though.
There's some more questions.
Ask us pop culture questions. I would love to talk to you.
Okay, I like that. Alicia?
I think this is just another sign, another show of Trump's team of communicators. And if we can communicate with them on value-based care, then I think that's always a good thing.
I like that.
Yeah.
Daryl?
No, I agree with Lauren and Lisa. Come talk to us at conference. Let us know your reactions to presumably Dr. Oz runs CMS, and so we can take your message to him and his team as he staffs up over there, so we can continue. If he's focused on prevention and preventing chronic disease, there's definitely an inroad that we can work with there.
Right up our members' alley.
Yep.
All right. Well, thank you very much. Appreciate the time and the expertise, and hope you all have a good day.
Thanks for joining us for Filibusters in Fine Print. This podcast was brought to you by AMGA. For more information about AMGA's advocacy efforts, visit amga.org/advocacy.